Well, that was the second poster presentation we made. And what we were trying to understand in this was how the centralized shared decision making impacts patients and clinicians. And there too, we interviewed both participants and physicians. And shared decision making was started with because there was a sort of a general perception that maybe the balance between benefits and harms was close. And they felt that the insurance companies felt in order to approve the screening, they wanted to add this as a requirement, which was providing participants additional information so that they could understand their risks and benefits a bit more and then make a decision. Overall, I think in general, the idea of sort of a shared decision-making process is a good thing in all aspects of medicine. To require it just for lung screening as opposed to other screenings, I think is a problem because it makes it seem like it's, very iffy. But beside that, what we really were studying in this report was the concept of doing a centralized shared decision-making, meaning that the clinicians themselves who referred the patients were not the ones doing the shared decision-making. They made the referrals, and then the patients would come and a nurse practitioner at the central site would do the actual shared decision-making and explain it to the patients. And we do this because we have a large program. We have several hospitals, and clinicians, especially family practitioners, are very tight with time, and the amount of time that it might take to do the shared decision making they felt was burdensome. And this way sort of makes it much easier because it's done in a very standardized way. They just have to refer the patient. So that was the concept. What we wanted to see was how patients felt about it and how physicians felt about it. And the sort of the bottom line was that many of the physicians, they understood the basics about who should be referred. They didn't fully understand all the details as to what really goes into a shared decision-making process. So they really kind of stepped away from it and left it to the centralized nurse practitioners to actually do the shared decision-making, but also they sort of lost a bit of all of the details that really would normally go into shared decision-making. The participants who underwent the shared decision-making with the nurse practitioners, there was where it got very interesting. There, they kind of felt that by the time they saw the nurse practitioner, that the physician had already wanted them to be screened. So they take the recommendation, go get screened. They haven't had the shared decision-making with their private clinician who's referring them. They simply go and get the shared decision-making by somebody else. And when you really question them, they feel that the decision had already been made before they even underwent shared decision-making because they'd already been referred. So it kind of defeats the purpose. It's something we didn't realize. I think this goes on in a lot of these kind of programs where they took it that their physician wanted them to do it, said, just go get it done. And then they go and get a shared decision-making, but in the back of their minds, they're thinking, my clinician wants this done already. They almost didn't realize they were going through a shared decision-making. They just felt like they were getting some additional information, even though the nurse practitioners are trained in doing it. So in a certain sense, this kind of defeats the whole principle of shared decision-making. And it's something we need to be more aware of, that when the clinicians are just referring, the idea is that, no, you should be doing the shared decision-making more up front. Patients shouldn't have the feeling, I've already been told, go get this done, and you need it and go get it. So kind of defeats the purpose. So that was kind of what we found out. And it's something that we need to, incorporate into our thinking about how we do shared decision-making, if we even do it, or whether, that's a whole other topic as to whether or not we still need to be doing this, et cetera. But in terms of how it's done with the centralized approach, we think that we've identified something that we were a bit unaware of.